This is our family assessment assignment for Juniper July 14, 2025 for Nursing 3320, Section 90. The family we're going to be assessing is the Smith family. Their address is 634 Magnolia Drive in Independence, Louisiana. Their family composition is Mrs. Smith, the mother, has 3 children. 2 of them are grown with their own families. One child, a 14-year-old boy, who still resides in the home. The stepfather, Mr. Smith, has 4 children, all whom are grown with their own families. The son, who's 14 years old, is a sophomore in high school at Hammond High, and they also have 1 cat and 1 dog. Between the mother and stepfather, they have a total of 9 grandchildren. The mother in the Smith family was born in New Orleans. Her parents were from Mississippi, her mom, and her dad was from Honduras, so there was some influence from there, such as food choices. The stepfather of the Smith family was born in the Hammond area at North Oaks Hospital. Before it was named North Oaks, I believe it was known as 7th Ward. His parents are also from the Hammond area, but they are deceased, both from leukemia. The language spoken in their home is English, but the mom can speak a little Spanish. All of the children were born in the United States. The Smith family identifies as a white family. The Smith family doesn't identify with any particular religion. Mr. Smith's sister is Pentecostal. The Smiths celebrate major holidays as most Americans do, but they don't go to church or participate in any religious organizations. They also do not have any religious practices or rituals that they engage in. There are no religious objects or artifacts in their home. The Smiths family is most probably considered upper middle class. Miss Smith is a registered nurse, and Mr. Smith owns his own business, a metal recycling business in the community. They own 2 homes, one that they live in, and the other is for Mr. Smith to go to on the weekends to fish on the river. They own 2 vehicles. Mrs. Smith is the primary breadwinner, but she also pays for all of the family's expenses, with the exception of car insurance and Mr. Smith's vehicle payment. He pays those. The family considers their income as adequate. They're able to pay for all of their expenses, have money saved, and they are able to vacation a few times a year. They are currently in stage 6, the launching center. Although the Smith family has grown children that live on their own with their own families, the last child is 14 and in high school and still lives at home. The Smiths have open communication with all of their children and grandchildren while maintaining ethical and moral standards. The Smiths have a satisfying marital relationship. Mrs. Smith was previously married for 15 years to her children's father when they divorced due to issues with domestic violence and substance abuse. Mr. Smith was also married to his second wife when they got divorced due to infidelity and substance abuse on her part after 15 years. Mr. and Mrs. Smith met while working at a local store that his ex-wife owned. Mrs. Smith's family originated in Westwego. Her mother was a psychiatric nurse and her father was a contractor who owned his own business. She has 2 sisters from their marriage. The parents divorced in 1995 after 25 years of marriage. Mrs. Smith's father then remarried and had 2 children with his new wife. Mrs. Smith has a good relationship with her parents. Her mom lives about 2 minutes from her and her father lives in Mandeville, Louisiana. Mr. Smith's family originated in the Ponchatoula area. His mother was a homemaker and his father owned the recycling business that Mr. Smith now owns. He has 1 sister and 1 brother. He is closer to his sister than his brother. Mr. Smith's parents are both deceased. The Smith family resides in a 3-bedroom, 2.5-bath house that they own. The house is red brick with a big yard. The grass is cut with a flower bed in front, maintained by Mrs. Smith. The rooms are adequately furnished. The extra bedroom is used primarily for storage, but there is a bed and dresser in it. The home is adequate for their needs. There is a patio with a TV and a half bath for outdoor entertaining. There are no rugs or exposed electrical cords. There are smoke detectors in every room and they are operational. There is a fire extinguisher underneath the kitchen sink where some cleaning products are kept. Medicines are stored in the kitchen cabinet at the top where they cannot be accessed by children. Most of this medication is over-the-counter Tylenol, Advil, and allergy medications, no prescription medications. Mr. and Mrs. Smith moved to their current location where they have been for 5 years from Ponchatoula. The likelihood of them moving again is not likely. The Smith family does not use any community services, agencies, or groups. They feel that some people may need these services and are glad they are available to those that need them. The Smith family may interact with people in the community at work. Mr. Smith interacts with vendors and customers and his workers, who are his 2 sons. Mrs. Smith interacts with her co-workers while at work and family at home, often spending time with her elderly mother on her off days. The Smith family receives no support from the community, such as resources or financially. The Smith family's definition of health is not being sick, such as cold or flu, or having more serious illnesses, such as diabetes, hypertension, or high cholesterol. Mr. Smith has a PCP that he sees every 3 months with ordered blood work. Mrs. Smith visits her PCP every 3 months, but is often non-compliant with lab work due to her fear of needles, so she has them done probably once a year. Mr. Smith has had a colonoscopy due to his age and compliance, while Mrs. Smith has refused to do so. Since Mrs. Smith is a nurse, she often has access to nurse practitioners and doctors if she should need any health information or advice. The Smiths believe that they are pretty healthy. The family avoids sugary drinks and juices and fried foods. They get around 6 hours of sleep per night. Mrs. Smith hikes, goes to the gym, and walks often with her son. Mr. Smith leads a more sedentary lifestyle due to his weight. Hypertension, high cholesterol, and diabetes run in their family. When needing to see a doctor, they drive themselves to the PCP's office. They pay for their health care with private health insurance provided by the state of Louisiana, whom Mrs. Smith works for. Family stressors. Mrs. Smith's mother has recently had to have a stent placed and required an ER visit, which Mr. Smith had to take her because Mrs. Smith was working. This then required a multiple night hospital stay, and Mrs. Smith and her son had to go and take care of her 2 dogs and cat multiple times a day. When things like this happen, the couple talk about the situation and figure out a solution. Mr. Smith often helps out with Mrs. Smith's son with transportation to and from school, or her mom to the doctor, due to his schedule being a lot more flexible. The Smith family does not use any dysfunctional coping strategies such as scapegoating, threats, and neither has an addiction problem. The nursing diagnosis is a risk for caregiver role strain related to multiple roles and responsibilities as evidenced by feelings of overwhelming responsibility. The outcome should be that the caregiver demonstrates effective coping strategy, and the interventions are assess the caregiver's stress levels, teach stress management techniques, and connect with support resources. The Healthy People 2030 objective is to reduce the prevalence of anxiety or depression among family caregivers of persons with disabling conditions. DH-D01. The care of Mrs. Smith's elderly mother, along with her immediate family and working, is very stressful. The references I used were the Healthy People 2030 website and the textbook Family Health Care Nursing Theory, Practice, and Research.